Hi, good morning, Patrick. My name is Mossy Gray. I'm your invigilator for the OET speaking session on the 20th of May 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Patrick Burr.
And what is your candidate number, please?
My candidate number is 275032777.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What topics for conversation with patients do you like the most?
We nurses do not treat only the body of our patients. We help the patients to feel welcome, secure, respected, and recognized while they are forced to stay in the hospital or a nursing home. I actually prefer listening to talking, and I always try to encourage the patients to recall good memories, or I basically choose topics that will help the patients to forget their problems for a while, to set their minds the right way, to bring peace to their souls.
Do you like to spend time with old people?
Yes, I prefer to work for old people, and I consider it my duty and responsibility to help them to enjoy the winter of their life. They really require our care and support. Being a nurse, I wish to provide the utmost assistance to them possible. I also enjoy spending time with them, talking to them and being their listener who wishes to share their view.
Can anyone become a nurse?
The job of a nurse is demanding. One should be ready for the position both mentally and physically. Unless a person has the right motives, he or she can't be a nurse because they lack the desire to help people, and it will not make them happy in life. Moreover, they won't be a great nurse and won't sustain the pressure for a long time. If someone has a desire to help others, or perhaps has a personal experience with nurses from their childhood, like if nurses became their role models, then they are motivated to pursue this career.
Why did you choose to become a nurse?
It has been my dream to become a nurse since childhood. I believe nursing is a noble profession. Once, during 4th grade, I was admitted to the hospital for dehydration where I was looked after by nurses who cared for me like a family member and helped me to recover quickly. Furthermore, reading the chapter on Florence Nightingale during my school days made me much more inspired. I strive to deliver high-quality care and maintain the well-being of patients by helping those who are in need. Still, I hold the passion and I am proud to be a nurse.
According to you, what is the most rewarding aspect of nursing?
For me, there's no greater feeling than seeing people improve, recover, and go back home to their loved ones. I love helping people, offering them the necessary treatment and emotional support every day. The fact that I know I am making a positive difference in someone else's life is what makes my work meaningful.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start the role play. Don't worry if I stop you when the time is up.
Good morning. My name is Patrick Burr, one of the nurses working in the emergency department. How may I help you today?
Good morning, Patrick. I am here because I am worried about a patch of skin on my lower left leg.
All right. Before proceeding further, can I have your full name and age, for the records please?
Sure, my full name is Mossy Gray. And I'm 36 years old.
Thank you, Mossy. Well, when did this happen?
It started 2 days ago.
Okay. Now, for my better understanding, could you please explain in detail about your condition?
Yes, nurse, I will. Actually, the area of skin has been red, inflamed, and warm to the touch. Also, it is painful when touched.
I'm sorry to hear that, Mossy. For clarification, I would like to ask you a few more questions. Shall I proceed?
Of course, you may please.
Thank you. Mossy, have you experienced any other symptoms?
No, I haven't experienced any other symptoms. Oh, yes. Well, nurse, I felt shivery for the last few hours.
All right, noted, Mossy. Apart from that, did you feel a headache or nauseous?
No, nurse.
Good to hear that you haven't experienced such symptoms. And Mossy, did you notice that the affected area has spread or changed in appearance?
Yes, nurse. I noticed it. The affected area has spread since yesterday.
Don't worry, we're here to help you. But before starting the care, I would like to know some more details.
Sure, no worries.
Thank you for your understanding. Mossy, do you have any ongoing medical conditions?
Actually, nurse, I don't have any medical conditions, apart from type 2 diabetes, which was diagnosed last year. But it is under control with insulin injections.
Happy to hear that your diabetic is under control. So other than insulin, you are not taking any medications. Am I right, Mossy?
Yes, you're right, I am not taking any other medications.
That's perfect. And Mossy, may I know, have you taken any treatment for the current condition?
No, nurse. I haven't tried anything.
All right, Mossy. It is very much appreciated not to take self-medications. Always seek the medical attention in such conditions.
Definitely, nurse.
What do you suspect as the cause of this problem?
Nurse, I think an insect might have bitten me a few days ago in the garden. That is just because I felt a slight sting while gardening.
Okay. Your thoughts are considerable. It can be the cause for your symptoms.
Yes. Actually, nurse, the bite itched at first, but hasn't over the last 2 days.
All right. I acknowledge your words.
Nurse, my concern is that it might have caused the problem by scratching my skin a lot when I felt terrible itching.
Your thoughts are quite natural. Don't worry. Be calm and relaxed. It's normal to scratch the skin under such circumstances. However, I can assure you that coming to the emergency department was an appropriate decision you have taken.
Okay, nurse. I got it.
You are in the right place, and we will definitely help you to cure your symptoms. Don't be nervous, Mossy.
That's so kind of you, nurse.
No mention, please. Mossy, I'll now explain the steps we will be doing next.
Okay, nurse.
The next step to be followed is checking your vital signs.
Oh, I see.
Yes, initially we will be checking your pulse, temperature, blood pressure and other possible blood tests, thereby allowing us to identify the causative agent or factor for your condition. Followed by, the doctor can provide you with appropriate care.
All right, nurse. I got it.
Okay, Mossy, do you have any other concerns?
No, nurse. It's fine.
All right. Please be patient. We will proceed to the next steps at the earliest.
Okay, nurse.
Thank you for your cooperation.
All right. That's the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.